Hello and welcome to Living with Allergies. I'm Dr Polly James, clinical psychologist, and this podcast is a space for sharing the real, lived experience of allergies. In each episode, I'll be talking with a range of people, from healthcare professionals working in the field, to parents, young people and individuals navigating allergies in their everyday lives. Together, we'll explore what it's really like to live with allergies, how it can affect day-to-day life, emotional well-being, relationships and confidence. These conversations offer a bit of a window into the therapy room, a reflective space to gently explore and make sense of people's experiences together. We'll touch on things like anxiety, managing risk, and the impact on quality of life, as well as the way people cope, adapt, and find what works for them. My hope is that through these conversations, you might feel a little less alone, find something that resonates, and maybe take away a few helpful ideas along the way. So wherever you're listening from, I hope you can take a moment for yourself as we begin. Hello and welcome to Living with Allergies. I'm very excited to have a very special guest today, José. So now José wears two hats, one as a leading children's allergy specialist and one as a dad navigating allergies at home. And also one I've just been aware of in our chat before, he also has allergies himself. So it's going to be a really exciting, big conversation. So we better get started. So just a little bit of background for those, I'm sure most of you are aware who José is, but he's a consultant paediatrician specializing in children's allergies with many years of experience in supporting families with a wide range of allergic conditions. He's worked across both NHS and private services, including leading paediatric allergy teams at hospitals such as University Hospitals Coventry and Warwickshire and Sherwood Forest Hospitals. He now runs a specialist children's allergy clinic across the UK, supporting children with food allergies, asthma, eczema, hay fever, and more complex presentations. He's a fellow of the Royal College of Paediatrics and Child Health and a member of British Society for Allergy and Clinical Immunology. And he's also involved in teaching and research as an honorary clinical lecturer in allergy, with particular interest in immunotherapy and improving how we diagnose and manage allergies in children. But today, we're not focusing on all of that, and there's a lot more that I could have said.
Good.
So alongside all of this, José is also a parent of children with multiple life-threatening allergies and himself with also life-threatening allergies. So would it be all right if we start at the beginning with your own story, José? Because
Absolutely.
I understand that a lot of people might have assumed you get into allergies because of your son.
Mhm.
However, there's more background to it.
Absolutely.
Please tell us from when were you first aware that you have allergies and what are you allergic to? And tell me more.
I started noticing that I had allergies actually
Mhm.
probably in my early teens, because
Okay.
one of the things that would happen and it had a massive impact on my life and my quality of life is that I used to walk from home to high school, and we're talking about a 15-20 minute walk. And in spring and summer, I used to walk non-stop sneezing until I
Right.
got there. Often as I was in class, I had to get out because I had to wash my nose, I had to wash my eyes because my nose was blocked, my eyes were swollen, and I used to suffer quite a lot with it. So playing outside on the playground with the rest of my friends on recess sometimes was very, very tricky for me. So I had to take medication all the time, mainly antihistamines, to control these symptoms.
Mhm,
But the
mhm.
things got worse at one point because I knew that when I was around cats, I didn't feel very well, very itchy. My eyes started getting red. And one day, I spent a night over
Mhm.
at a friend's house that had cats.
Right.
And during the night, basically, I stopped breathing.
Wow.
So, and I didn't understand what was going on. I went to take an antihistamine, and I spent hours because it was winter at that time. I spent hours literally in my head outside of the window, and that between the antihistamines and all that, that's what saved me.
Wow.
As you can imagine, as a young teenager, I had no idea what was going on with me. But one of the things that I decided then is I was not going to go again and spend a night there because I felt so dreadful. And the next day, as soon as I could, I left and I went home. So, because of this, I thought, what is happening to me? And eventually, when I went to medical school, I started reading a little bit more and find out that actually what I had was anaphylaxis because I had a severe breathing compromise. And that was the reason why I decided to go into allergy.
Wow. So at that time, so just going back to that first experience, sounds like you were aware that you had allergic rhinitis, you had
Yes.
medication for that, and your parents were aware. Was that
Hmm.
sort of what was the narrative around that? How did you manage it? Because I know for particular people with suffering severe symptoms, it can really impact the exam season and
Hmm.
being able to concentrate at school. How were you brought up, and what was the narrative around allergies, and how did you cope with it?
So, we're talking about Um, without
Mm.
without showing that I'm very old,
A few years
uh,
ago.
it was a few decades ago, and as you can
Yeah.
imagine, allergy, the awareness around allergy, especially airborne allergy, was not as good as it is now.
Yeah. Right.
But actually, I spent 7 years in the forces. In
Ah,
Portugal, it used to be compulsory, and
sure.
because of that, I already knew that something called immunotherapy was happening. Although
Right.
not the people were doing it, but I decided to go ahead and do it. So
Wow.
I had
Wow.
immunotherapy for 3 pollens. So,
Wow.
and my life changed dramatically since
Okay.
the moment I've had immunotherapy for 3 pollens. And I'm
Amazing.
talking that I had immunotherapy for 3 pollens nearly 40 years ago, and
Right.
still now, when there's a 3 pollen season, I have zero symptoms.
Wow.
And that is why normally when people talk about, or my patients talk about immunotherapy, I tend to say, look, I'm biased
Yeah.
because I
Because
had
what works.
immunotherapy nearly 40 years ago. I saw the change in me because, again, literally eyes very swollen. The typical extreme signs of allergic conjunctivitis, I used to have them. My eyes could not be open. I could not see. Plus the sneezing, the bad sleeping, the inability to study appropriately. And I tell you,
Yeah.
going through medical school or going through high school to the equivalent to the GCSEs and A levels to go into medical school was dreadful for me.
Oh, it must be awful. I mean, I've treated children who suffer severely like yourselves, and there were times where they just couldn't go to school,
Yeah.
especially if there was loads of grass areas between buildings. And, I've seen children that need to be homeschooled because the symptoms are so severe and they just can't be out and about. And for a lot
Ah,
of people, they might not realize that one of the first immunotherapies are to tree pollen and things. Obviously, it's much
yes,
more people are aware now of food allergens as treatment and OIT. But
absolutely.
so in Portugal, it was you that sort of decided, I want to do this, I want to embark on this. Were your
Ah,
family on
yeah.
board? Was it private? Did you have to pay? How did you access that?
So because at that time I was still in the army,
Oh,
and interestingly, I had been placed because I was halfway medical school when I had to go to the forces, and
right,
then
go back.
eventually, for that's a different long story. Then I was placed in a military hospital in my hometown.
Right.
So while I was in a military hospital, I spoke because at that time it was one of the respiratory consultants that did that. I spoke to that respiratory consultant,
Ah,
and I started doing the immunotherapy.
ah,
So I paid for the medication. The army paid the percentage, but I
okay.
paid for my medication. So it was a kind of semi-private that I did,
Yeah.
and I had monthly injections for 3 years.
Wow. That's a huge amount of self-advocacy. I think obviously having your medical background made you
Yes,
very aware and probably on board with the treatment procedure. And because, 40 years ago or whenever it was, maybe less,
there was
um,
not much known.
there wasn't much known, and you
No,
would have been sort of pretty brave and
and I
yeah.
tell you one thing, for the first 6 months, honestly, I thought that I was throwing money out of the window because it was so
Yeah.
there was not a lot of information about that, and I was like, "Is it going to work? Is it not going to work?" And when I went to the next pollen season and I
Yeah.
saw a dramatic change in my symptoms, I thought, "Oh, no, this is working. I'm not going to stop this." And I
Okay.
did, and I finished it.
And then going back to that really sort of horrific episode when you were staying at your friend's house,
Mm.
you obviously had an awareness that you were allergic to cats, or at least you were symptomatic around cats. And that led you to treat yourself in the night in that way by putting your head
Yes.
out the window, obviously to get away from the cat dander and also taking antihistamines. How did you tell your parents about what happened then? How did you then manage that allergy moving forward? And what
Mm.
was the treatment then? What did you do?
So I told my parents. My parents were worried about that.
Mm.
So they were highly supportive. Naturally, worried that what happened because they were far away.
Yeah.
Fortunately, at the place where I was, the father of my friend, he was also a doctor. He was a
Okay.
cardiologist, a very well known cardiologist. So eventually in the morning they saw what was happening, and they supported me. Um, but from that point onwards, he's mainly avoidance. If there are friends that have cats,
Hmm.
they know I won't go to their place.
Yeah. And how did
Even
you
if it
cope?
is for a drink or a meal, I won't go there.
Yeah, makes sense. And did you get administered a adrenaline device or anything, or just
No,
anti?
because there was nothing like that around. It's one of those situations that I was an example of how a lot of people that have anaphylaxis, the
Hmm.
reason why they survive the anaphylaxis is because of the stress that they go through and their own adrenaline production that will save them. And I think that because I was quite stressed. That
Hmm.
plus taking actually, I don't know. I didn't take one antihistamine. I took a few of them. I didn't know.
Sure.
I don't remember how many I took.
Yeah.
I don't because at that point I couldn't care less if I was going overdose myself. I just took a few of them, and we know now that cold air acts as a vasoconstrictor, so it actually decreased somewhat. It decreased the inflammation on my airways, and I was able to breathe because I was really struggling.
And that and those the actions that you took in that state of shock and
Yeah.
having anaphylaxis, do you feel like, because often we say, and a lot of children, for example, that I see, or parents with children with allergies, they're so worried about anaphylaxis, about doing the right thing in the moment. And it sounds like it's almost that innate sort of protector in you that went to the window, to the cold air, took
Yes.
as many antihistamines, kind of, it probably was right to not overdose, but to take more. You just
Yes.
to like really follow your gut instinct and treat yourself.
I tell you one thing. Now it's easy to think retrospectively.
Mm,
Now, if I had an adrenaline injector,
mm.
I would have used it straight away.
Yeah,
But
yeah.
at that time, I didn't even know about adrenaline injectors. There was none in the houses because there was no one with allergies in the house. The only thing that we had, because I used to carry them with me
Mhm.
for my hay fever. And interestingly, that although it was winter, I still had my antihistamines with me because I carry them with me, and that's why I took them straight away.
And has that been your main reaction? Have you had any other further episodes of anaphylaxis
I
yourself?
had minimal ones to cats, um, mainly because I also have a few friends that because they have cats when they come and meet me. I can see straight away because I give them a hug, and if I start rubbing my eyes or rubbing my nose, I know, okay, your cat probably was near your clothing when you came around, didn't they? And they say,
Mhm.
oh, yes, okay. I say, okay, give me a second. I'm just going to take an antihistamine. Please take your coat away or whatever it is that is full of your cat's hair, and then we keep on talking. But yeah, so apart from that, I completely avoid them. I completely avoid them.
And do you feel sort of psychologically that's how you manage to still be able to go to people's houses or meet people? You didn't sound like there's too much anxiety. How do you cope with, because obviously it was a very distressing reaction.
Yeah,
How have you
no,
coped
not a
mentally?
lot of anxiety. I just know if anyone that invites me to go somewhere or to have, especially more in Portugal, there's a couple of good friends of mine that they have cats. They know that if we are planning to have a meal, it's going to be out. It's not going to be at their place.
Okay. And it sounds like that's something that is medically necessary.
Yeah.
Therefore, it doesn't create, because a lot of people have this sense of worry about being a burden or a nuisance, and that's something that you've coped with well, because it shouldn't be
Yes,
not you deserve to eat. So,
but I think that the other part is when you have a friend.
mm,
They will understand your problems, and they
mm,
will not feel judgmental
yeah.
or annoyed or hurt because you say, sorry, I cannot go there, because they know that it is your health on the line,
Mhm.
and they accept it. For them, it's fine.
I think that's really helpful for people to hear because a
Oh,
lot of people
some of my
carry
friends
that
just joke about
sense.
it. They just say, "Oh,
Yeah,
less pots and pans for me to wash."
yeah, and but that's the reality. You deserve to eat. They care about you.
Yeah.
It's it's not a weakness, it's a medical condition, and you
Oh,
need to
absolutely.
kind of judge.
Everyone takes it as a natural thing. They don't take it. There's no second thoughts. There is no grudge against because whatever. No, no, no. They take it well.
That's really helpful. Is it okay if we move on to your experience now as a dad, an
Oh,
allergy dad?
yeah. Go ahead.
Do you like that label? Um, how could you tell me a little bit about your experience then with your son and what happened?
So my son, he has a peanut, tree nuts, and pine nut allergies.
Okay.
And the wheels on skin prick tests are quite big,
Okay.
quite big. The only tree nuts that he's not allergic to are almonds and Brazil nuts,
Mhm.
which he eats.
Okay.
And it's one thing that I've done throughout his life. He's now 17.
Okay.
Is make him eat almonds and Brazil nuts frequently. Brazil nuts not so much, simply because he doesn't like the taste. I don't like the taste very much as well. So, but once in a while he might nibble on them.
Okay.
But uh, interestingly, he I started offering all sorts of allergens when he was young.
Mhm.
Uh, Possibly, he started to think about what happened 17 years ago. But I think that possibly I didn't offer him as many tree nuts as I should. But also, he had eczema and on a house in which
Okay.
nuts are being consumed. I think that probably sensitization to tree nuts and
Mhm.
peanuts and so on came through that,
Okay.
the potential skin sensitization.
Yes. Mhm.
So when he was a toddler, and that was the first time that I saw that something was wrong. One day I was cooking and I had, those honey roasted peanuts.
Mhm. Yes.
I had
Mhm.
some honey roasted peanuts with me, and my son was there, and I said, "Oh, I thought this is something that he's going to enjoy. It's honey roasted." So I gave it to him, and I remember he looked at me with that stuff, and the first thing that he wanted to do, he went to spat it out. So
Okay.
I thought, this is interesting. Okay. And no other reactions, but I started questioning what was happening there. Why did he spit it out?
And that wasn't normal for him. He was normally quite
Was not
curious
normal
and
for him
adventurous
because
around
he
food.
eats all sorts of foods
Mhm.
without any problems. He has no food restrictions.
Okay.
He's always been a very good eater. So I
Mhm.
thought, very odd. The
Mhm.
following weekend, actually had cashew honey roasted,
Okay.
and I gave him a cashew. So I thought, okay, different one. Let's see. And he did exactly the same thing.
Mm.
So I was like, this is very odd.
And no oral symptoms? No, nothing?
Nothing. He just spat it out. Nothing else. And then there was a dinner out with some friends. Oh, actually, I remember. So there was a colleague of mine that there was this celebration for it was this Indian celebration,
Mm.
uh, the equivalent to a christening celebration.
Okay.
And my son and I were there, and suddenly he had the food, and soon after, profuse vomiting.
Oh, no.
So, okay, I stopped it. I went to see what was there in the food, and interestingly, the food had peanuts and
You
cashews.
went straight to the food, so you had this sort of
Yes,
feeling that it was something he'd eaten rather than a virus. You kind of went straight to the food.
I went straight to the food.
You mm,
So I went to that one. I found out it had peanuts and cashews. I gave him antihistamines, kept an
okay,
eye on him, thinking, let's see what's happening here, because he only had vomiting. So I kept an eye, gave him the antihistamines. Things settled, fortunately, and I booked an appointment. I booked
okay.
an appointment to go and see, asked for everything to be tested. Uh, Interestingly, when he was tested for sesame. Although I said that he eats hummus frequently,
Right.
but they decided to test him for sesame, and sesame came back positive.
Mm,
And I thought, for me, this is probably a false positive.
mhm,
So
mhm.
actually, I continued to offer
Yeah,
hummus and sesame to my son, and
mhm,
on subsequent skin prick tests, sesame came negative.
Okay.
So,
Interesting.
and the interesting, this is another part that is interesting for some parents to be aware
Yes.
that
Very
the
interesting.
risk of false positives,
Mhm.
the testing for foods that people are eating frequently should
Mhm.
not be done, and that's what I tell parents because it can bring a false positive.
Mhm. I have experienced it many with some of my patients that the parents or adults with allergies have had their child tested or themselves tested. They're eating something frequently in their diet. It gets tested. It shows it's positive, and then they stop eating it because, of
And that's the
course,
problem.
understandably, they're worried that they are reactive. And yeah, so that's really interesting that you continued with because
Yeah,
obviously with the hummus, the tahini, the sesame paste, you continued to give it to him, and
yeah,
he was okay.
but do you know what is interesting as well? And of course, I did it against the advice from other people.
Mm.
Is although almond and Brazil nut was negative, I was also told not to give almond and Brazil nut to
To
my son,
avoid that the advice
which
back then.
I
Mhm.
ignored.
But
And
now
I
what's
kept,
the advice?
and
You
I
were
kept on giving almond and Brazil nuts
you were a
because
trailblazer.
yeah,
Yeah.
you know,
Where were you in your medical career? So obviously 17 years ago, just a little kind of rewind a bit. What was the advice around weaning and allergens and people of high risk?
uh,
Were you aware that he was more high risk because of your allergies, or was that knowledge and research then not there yet? Or
no, I already had that knowledge because at that time, so I don't remember if I was already in my first post as a consultant because before I was a consultant, I decided to be. I went as a senior fellow for nearly 1 year,
okay,
and then the people at the hospital where I was working, they kept on saying, "Look, you should not be a senior fellow. You should be a consultant. You have the experience and all that." But sometimes I think that at least I feel you need to find your grounds before you
mm,
move from being a senior registrar into a consultant. It's a
mhm,
big jump in decisions wise. So I don't remember if I was already doing allergy clinics and so on. So I
okay.
already had the knowledge.
What
But it
was
was
the
interesting.
advice and the knowledge then for weaning? What was
Yeah,
it?
but that's the thing, which still happens now, is what you're going to find among the NHS, north to south. You're going to find people that say give all the foods, and you're going to find people that still say exclude foods.
Mhm.
It puzzles me why they do this, why they don't say introduce, knowing that the exclusion of things that you're not allergic to can lead to the
Mhm.
development of allergy. And it's interesting because one of the things that stuck in my head many, many years ago, actually, when I was at the Evelina,
Mm.
I did a piece of research with Helen Broth
Mhm.
uh, about, and this was a retrospective research about children that had gone to clinic and they were monosensitized.
Mhm.
And what would happen if the advice was avoid and if the advice was introduce? And then
Okay.
we follow these children. And we noticed that the ones that were being advised to avoid became polysensitized,
Okay.
while the ones that were told not to avoid kept
Mhm.
on being monosensitized,
Okay. Interesting.
which
And so you
made
had this
my idea
knowledge already.
stronger that you
Mm.
need to give foods.
Mhm. So for your son, you were introducing sort of peanut, cashew, uh, and you also where were you that you were doing allergy introduction, or was it
Yes, I
something
was.
you
Yeah, I
were?
was.
Because
So,
you said
so
1 week it was peanut, then it was cashew, and you were trying to kind of introduce these foods.
Oh, absolutely. Because when I was a child, I
Mhm.
introduced eggs, I introduced fish,
Mhm.
I introduced sesame,
Okay.
chickpeas, all sorts of things were introduced into his diet. And as I said, we never avoided things
Sure.
with nuts, but I
Mhm.
was not actively giving
Mhm.
nuts frequently. And I
Yeah.
think that probably that was my mistake. If there's
Well,
something for me to blame about it, is because I didn't do that more frequently.
it's always easier with hindsight to look back and feel like there was some sort of perfect allergen
Yes.
introduction that would have, but you know yourself, you have family history,
Yes,
and
absolutely.
there may not have been anything you could have done. And I hope that you don't hold that guilt. I know you're saying it now
Oh,
because
I
especially
did for the first few
you did.
years
Yeah.
because it is the natural. the natural thing of being a doctor and being a father and being an allergist at the same time. But then, we know the reality that the likelihood is, even if I did all that, it possibly still would develop the allergies anyway.
Absolutely. And also, the reality of what it's like day to day and what it can be in a clinical trial and how it's in those certain set of circumstances and then in
Yeah.
family life and the reality. And actually, you did do really great introductions and
Mm.
you were very aware, but being able to do it by the textbook in life is not always as simple, which I think is probably a very helpful perspective you can hold as an
No,
allergist. And
absolutely. For you to have an idea, for instance, because my son is half Chinese,
hmm
one of the things that they do a lot there in China, not
hmm
in China because he's from Singapore,
okay.
is as a snack, they have boiled peanuts that are cooked with chestnuts.
Oh, right. Okay.
So, and they are cooked together because then the chestnut gives it a flavor to the peanut. It's actually really nice.
hmm
So, actually, when he was a very young boy, he
hmm
had those.
Okay.
He preferred the chestnuts. So he was eating chestnuts. So he was the chestnut that he was eating was already contaminated with peanut allergen.
Tolerating it.
Uh, so he was already being exposed to peanut allergen anyway. So he did have that, but nevertheless he developed an allergy.
Mm. And also, there's this sort of sometimes this maybe unhelpful belief, especially if you have a medical background and it's very diagnostic driven and it's all
Mm.
very task orientated, problem solving. It feels like everything can have a fix. And as you know, especially with complex allergic conditions and complex diseases, not everything has a fix, does it? So,
No, not at all. In Portugal we have a saying that
Mhm.
trying to say that is the same as saying that a shoemaker cannot have holes in their shoes.
Yes, and they very much can.
Yes,
Yeah, yeah.
absolutely.
I can relate to that as a psychologist and a mother. I do not have perfect children.
No,
Perfect
it
children.
happens,
Yeah.
and we need to understand that despite our background,
Yeah.
things will happen. Is life,
It
and
is.
life develops this way. And in a way, it's good that life is not perfect because otherwise, probably the world would be boring. But
Yes, and we'd
with
all have
this,
high expectations and suffer from anxiety
oh,
because we're constantly striving to achieve perfection, which is also incredibly unhelpful.
absolutely, I think that for me,
Uh-huh.
what worries me the most, or actually, what annoys me the most
Mhm, mhm.
is when going out, and I travel a lot with my son.
Yes.
Since he was before, he has been traveling since before he was 1 year old.
Okay.
Because of as the family is from Singapore, part of his family is from Singapore. We go often to Southeast Asia,
Right, yeah, you're very multinational, so you've got different
uh,
parts
and and
of the world.
and there's a lot of nuts in diet. So
Mm.
dealing
Yes.
with it has been sometimes a challenge. Actually, sometimes it's been quite easy because I find that people around there in Southeast Asia,
Mhm.
when we go to, I know Southeast Asia quite well, they actually are quite compliant. And
Right.
when you ask them about my son's allergies and avoidance, they actually tend to go out of their way,
Right.
which I
Interesting.
find it extremely interesting. And even last year, a couple of times we went to Vietnam,
Wow, okay.
and the guys there in Vietnam, when my son tells them they have allergies,
Mhm.
you suddenly have all sorts of people coming and speaking to him.
Right.
You have all sorts of people dealing with things in the kitchen to be safe
Yeah.
for him and all that. And they keep on coming back and asking, is everything okay? Is everything okay? Is everything okay? So I
Okay.
find this quite endearing.
Yeah.
And from safety point of view, you feel quite uh, uh, calm because you
Mm.
have someone that is really looking after you. Because he had a couple of reactions in airplanes.
Okay.
Uh, by when he was a younger kid, because he didn't read the ingredients and he had the first snack that came to hand, and then again he started vomiting, and twice it happened on Singapore Airlines because that's
Wow.
kind of when I travel there. And
Was this when he was on his own? But
he was with me,
yeah,
but
but he was in charge of his
during the night time, you have a nap,
yeah, of
and
course.
he
Yeah.
woke up and there was someone passing with a tray, and as a kid he just picked up something that he wanted to have. But what is interesting is the crew, they also went out of their way to guarantee that he was okay. And I found this okay that he had that. It was not their fault.
Yeah.
It was not their fault. In a way, it was. Yeah, I was asleep. It should have been me, but sometimes things happen. You know how it is.
Yeah.
And actually, that was also a teaching lesson for him, a very
Mm.
important lesson, because since then the asking about things has improved. Although sometimes now is different, but his kids, when they see a chocolate, they want to eat the chocolate.
Of course, yeah. Of course they do.
Uh, but since then, no problems, and especially as I said, traveling. I travel a lot with him.
It's
No,
really
in
interesting
places
to
where I've
hear.
been, in hotels, in restaurants, and all that, he has never had an allergic reaction.
I mean, it would be this is so helpful for people to hear because most of people with allergies, in particular nut allergies, will avoid Asia
Mm,
because most of their cuisine and culture includes a lot of nuts. And also, most people's fears are having a reaction on a flight. Now, you have experience of both of these, traveling in
yes.
Asia and having a reaction on a flight. And actually, the way you talk about it is, there isn't a huge amount of fear there. It sounds like, yes, he had a reaction. You have your medication. The staff were really helpful.
Mm.
What what else could, because I mean it's such a useful perspective to have, as you say, and I wonder if part of the reason why your son feels so confident with eating and food is because his dad is a he's a
Because his dad
medical
is
specialist and
annoying
he's,
him all
has
the
got
time to
this.
read
He's asleep,
ingredients.
but he's got it. Yeah. And possibly, I don't know, from your perspective as well, it'd be interesting to hear, as you say, he did eat something which contained nuts and he vomited on a plane. What helped you to stay, I guess, maybe not calm, but what helped you to manage that? Because that's a lot of people's worst nightmare.
Um, I think that probably that is the medical background.
Yeah.
Uh, you know,
Trust in the data,
because
trust in the medicine.
it helps being a pediatrician. It helps being an allergist, but
Mhm.
also helps because I am an NLS and EPALS instructor. So
Yeah.
I'm a newborn life support instructor, and
Okay.
I'm a European pediatric advanced life support instructor. So
Mm.
I need to be calm under
We just
pressure.
need to train everyone that has allergies as a pediatrician and allergist and life support. Yeah.
So the thing is, I'm looking at my son with due fear, but without showing that I have some fear in me about what is happening next. So I
Mm.
keep an eye on him closely. W-
Mhm.
What is interesting to note is that my son so far has never needed adrenaline.
Okay.
He only has needed antihistamines,
Mhm.
but nevertheless, he knows how to use his adrenaline. And whenever situations happen, I was there. The first thing that I did calmly when he was looking away was me picking up his medication and putting his adrenaline pens near me
Mm.
straight away. So it's the first thing I saw. Where is the adrenaline pens? They need to be near me. So when I did that with him, without him noticing that I was doing that,
Mhm.
but he was there in
Staying calm
case.
for him,
Yes,
but
if
also
if something
got
happened, I would have jabbed him straight away.
yeah.
But because there was no breathing compromise, there was no neurological compromise, I just
Mhm.
kept an eye on him, gave him his antihistamines, and saw how things were going on.
He's pretty efficient, vomits it up or just spits it out.
Yeah.
He's got a good gut reaction to what to do.
Fortunately, I hope it never happens again. But if it
No.
does, it's just that.
And how did his mum cope? Was she there? How was her experience of this?
Um,
How does she manage
no,
it?
because my son. I'm a single father,
Okay.
so my son has been with me for at least 14 years.
Okay.
So a lot of these experiences that I'm talking about is me and him.
So yeah, so you have the sole responsibility and
Yeah.
you're caring for him and it's you that holds. I mean, for many people they may have different roles. If there's the two
Oh,
partners there, one person is typically more involved in the allergy management, the research side of things,
yeah.
and the psychological side. So you're carrying all of that.
On that
And
one, I also wear all sorts of hats.
you wear many hats.
Mm.
Wow. Okay. And could just a little few more questions around how you cope as a dad. You always talked about travel and talked about
Yeah.
previous reactions. How do you manage it day to day, and what's your kind of how do you sort of help? How did you help him transition to independence? And what's sort of your sort of, I guess, your narrative, your story? What's your kind of way of talking about allergies and how you cope with them?
So I started empowering my son very early
Mhm,
for him to take ownership of his problems
mhm,
very, very early. So is we we go to our food shopping.
mhm,
He reads the ingredients of everything that we buy,
mhm.
first of all.
Okay.
And if he just
Labeling.
picks up and something there and
Mhm,
puts it there, even sometimes I'll be honest. Sometimes it's just on the annoying side. Let's say we pick up a bit of pasta, and I said, "Have
mhm,
you read the ingredients?" But Dad, this is just made with the wheat and all that. And I said, "I don't
mhm,
know. Have they
mhm.
changed the recipe? Read it."
Yeah.
And sometimes it turns to me and said, "Oh, you're doing that just to annoy me." And I said, "Possibly," but empowering for him to know, for him to understand that sometimes recipes can change,
Yeah.
first of all. And also we go to eat out, and we go often to eat out. And at the start I keep on telling him, you need to tell them what you're allergic to, you need to tell them what you're allergic to. And until he comes to a point, he says what he's allergic to, because I feel that especially when they are young teenagers, is almost this blame or guilt or fear of telling
Mhm,
someone that they are
mhm.
allergic, like if they are less than others are. And I've
Yeah.
always told him, no, you are exactly the same as others.
Mhm, mhm.
Because you have an allergy, but you don't understand if someone next to you might not have an allergy, but might have another condition that is also serious, life threatening.
Yeah.
So don't judge people because of allergies. Don't judge people because of what syndrome they have. Going to look at people like people. So everyone has their own problems. Deal with it as it is. And because I tend to say, and that's something I tell the parents of my patients is, have a normal life
Mhm.
despite the allergies.
Yeah.
Because people think that because they have allergies, their life is going to be dramatically different. No,
Mhm.
you can have a normal life with due caution,
Yeah.
but have quality of life. And that is what I try to empower
Mm.
the parents and my son. So my son has a normal life. He goes out, and now he's actually this weekend he's going to go out camping with some friends.
Really? Wow.
And
Yeah.
goes, but is whenever he goes, is interesting that the first thing that he goes and does, he goes and pick up. He has his bag with his medication. He puts it in his pocket straight away.
Great. Mhm,
So, and that is the thing that he does automatically.
mhm.
And sometimes he turns to me. He has had situations in which he said, "Look, Dad, I didn't know if the food that I had nuts or not." And I said, "Why?" And he explains to me why. And I said, "Okay, reason. Do you have symptoms? Do you feel anything at all different, or is it just your mind working?" And he reasons it.
Mhm.
And I say, "Look, you are the one that needs to decide. Do you need to take medication or not?
Yeah. Yeah.
Because you are the guy that knows. You will know before I do.
Mhm,
So reason with you."
mhm.
And sometimes he says, "Yeah, I think I need to take an antihistamine." I said, "Go and take it."
Okay.
Sometimes he tells me, "No, I don't think. I prefer just to keep an eye and see
Mm,
what happens." And I said, "Okay, do it." So, and I think that that's what people need to do.
mhm,
And you're talking about traveling. He knows that before we travel, I contact hotels, and I say, my son has this.
mhm.
Uh, if the reply from the hotel is yes, we can help you, we can do whatever, fine. If an hotel starts putting question marks, it's easy. I don't even think twice.
Just
Next
avoid.
one.
Mhm.
There's plenty of hotels. Just
Yeah.
choose one.
Yeah.
Choose a different one. Same with airlines. There's a couple of airlines. Honestly, I don't go.
Okay.
I really don't go. One of them, Emirates, I don't use.
Sure.
I
Sure.
think that they are dangerous for any person that has a food allergy.
Mhm, mhm.
So I don't use them. Uh, but for instance, we're talking about Southeast Asia. Street food, no.
No. Mhm.
You know, sometimes it is, I can have street food, but I'll find something nearby that is not street food that is going to be safe because you know that again because as you say the peanuts, the tree nuts that they use. So
Mhm.
street food, no.
Yeah.
Restaurants, we need to be very careful about what restaurants do they use.
Mhm.
Do they use sauces? Do they not use sauces?
Mhm.
And it's depending on all this that we decide on the food to keep things safe. But it
Yeah.
comes to a point. Uh, I feel that as time goes by, what used to be a very hard task to do starts being a normal event, and you
Mhm.
don't feel that struggle to deal with it. And I think that's mainly what I do with my son.
That's really, really helpful and such an important message for people that if you do all the proper allergy management, if you do a proper risk assessment, if you do, you know, extra, go above and beyond to the point where you feel absolutely this is safe,
Mm.
then you enjoy the food, you advocate for yourself. And
Oh,
that's another part is how do you not make it impact so much on your quality of life? Well, if you have that really good foundation in really good allergy management skills and a very useful kind of healthy risk perception, then you can travel and you can do the things you want to
mhm,
do. It might take more research and more work and more conversations.
absolutely.
But if on top of that, you also model to your child or for yourself that it's nothing inferior, there's nothing kind of weak about it, it is a medical condition, and you need to kind of, you deserve to advocate for yourself and ask the right important questions,
Mm.
that's modeled to you, then hopefully that can also help with self-esteem around allergies because
Oh,
for a lot of people,
absolutely.
they struggle. And even I'm sure parents do the best they can and do similar techniques to you. Some people do struggle with feeling like a burden or a nuisance, which they
Yeah,
absolutely shouldn't. But
indeed.
it sounds like you've tried your best to work both with the kind of medical safety side, which then gives him the ability to do the things he wants to do and to keep showing him that you need to ask the questions. It's
Mm.
important and managing that social threat of what do other people think of
Oh,
me?
yes,
Are the people judging me?
but
And mm,
one thing that is interesting as that comes with experience, you start to pick up on keywords.
okay. What are
When
your
you are having a
keywords?
dialogue with someone, there are
Mhm,
keywords. And when
mm,
you get whatever keyword, you know, okay, this is not going to be helpful. But you
yeah,
have other keywords and you need to know that people or that company or that hotel is going to look after
I get
you.
it. Mhm,
And as you start to do these keywords, is the turn on and off about shall I
mm,
go to this one or shall I change? So I actually spend less time now to make
mhm,
decisions than I used to in the previously at the beginning
right.
because I started listening to that keyword and I know, okay, decision made,
Mhm, mhm,
and again, I think that only experience will do.
yeah,
And that's why I say that the first years of living or having a child with allergies is probably a struggle until you feel comfortable about doing your things.
mhm,
And it is that, as you say, because if we don't normalize life,
yeah,
and especially from your point of view, look at the psychological impact.
yeah, it's huge. Mm.
Massive. But no, you normalize things. They know their boundaries,
Yeah,
but they still know that they can go out and eat and enjoy themselves within those boundaries.
yeah,
And that still preserves the quality of life
mhm, mhm,
and their social engagement instead of being at home all the time closed,
yeah.
because that is going to be far worse.
Far worse, but easier just to avoid. And so it takes bravery. And I think a
Mm.
huge part of what you've also instilled in your son and for yourself is practice and
Yes.
practice and practice. Practice from a young age of going and ordering and um, looking, label reading, but also practice in travel. So
Mhm.
obviously you're at a stage now where he can travel to Asia. And part of that has kind of it's almost helpful that you have family abroad because it's forced you into doing that. Whereas maybe if you didn't, you would be like, well, let's not go to Asia. I know a lot
Uh,
of families, they get
no, not really, because
no, you don't think so?
I I've always been a traveler.
You've been a travelers. It's been an important value of yours. Yeah.
Yeah, because that is a part of my background. Because although I'm Portuguese, I was
Mm.
born in Africa,
Oh, okay. Where in Africa were you born?
Angola.
Oh, do you like I'm wearing my African dress.
Yeah, I saw.
This
I
is
saw that you
Ghanaian.
had something there. So
Yeah.
the thing is, Angola was a Portuguese ex-colony. So my parents went to work in Angola
Mm.
from Portugal many years ago. So I was born there. So Angola, and Angola is massive. So I lived in several different places in Angola. Then Angola to Portugal, and Portugal here, and I went to work in a year in Switzerland. I love traveling. So
It's such an important
even
part
if
of your
his family,
identity.
yeah,
Hmm.
even if his family was not from Southeast Asia, I would travel anyway.
You would travel there,
Yeah.
but it's great. It's really helpful. It's really lovely to hear your story and your journey as both a adult with allergies and having a son with allergies,
Hmm.
and how you navigate it as well as a medical professional, pediatrician and allergist. So it's, been such a helpful conversation. And I just wanted to finish with one last one. We have touched on it in terms of how it impacts your practice. And I know that you have also tried to support lots of parents in terms
Hmm.
of helping them to not let it impact too much on their quality of life, and
Yeah.
advocating things like keep practicing and keep exposing them to situations, not avoidance. But how else do you think it's shaped you as an allergist or a doctor, having
Um,
that lived experience?
I think that having a child with allergies gives you a different perspective,
Mm,
because I can understand the worries, the suffering, the
mm,
fears that parents have,
mhm,
because I've gone through that. So, although my nature, the way that I am, I'm very much empathic with people. I think that is one thing is being empathic, the other one is understanding truly what an allergy is. And I think that all my background, myself, and my background with my son has given me that edge that a lot
mm,
of other people don't have.
mhm, mhm,
So when I advise parents about what to do and what not to do, and it's interesting that yesterday I did a video for Instagram about that,
mhm,
is because first of all it works. If there
mhm,
is research, there's evidence behind it.
mhm.
It's not just personal opinion. I try to avoid as much my personal feelings from it, because then we can be a bit too biased. Except with the immunotherapy for pollens, I'm in favor.
Yeah, and you,
But I tend to match this because I've used that research, I've used that evidence on my son.
yeah,
So what I done on my son is not just because I wanted to, is not because of my own thoughts, is
mm,
because of that research and that evidence. So,
mm,
and that is why in a way, I can almost say that in a way he's a kind of a guinea pig,
mm,
because he's done the things that has evidence base. And I translate that a bit to parents saying, so if I'm telling them, or if I'm giving you advice, is because I've gone through that.
yeah,
So it's
no,
not just because I read a piece of paper. It's I read a piece of paper and I've done it with my son. So I have the two kinds of experiences, and
mhm,
which helps a lot. And sometimes parents ask me a bit more questions, and I'm very honest with them. I'm very blunt about what I say. Um, and I think that this translation from several different fields is quite
mm.
helpful.
Really helpful. Having that lived experience, is so helpful for families, because they really do know that you know what you're talking about both medically and personally, and
Yes.
so that level of empathy is huge and can't be underestimated how much difference that makes.
Hmm.
Uh,
Absolutely.
Especially in the diagnosis, and as you know, how it can't be easy sometimes getting a diagnosis of allergies, and then the lived experience with it. So
Yes.
um, thank you so much. It's
You're
been
very welcome.
for conversation, and there's so many more questions I have to ask, but I think we'll go on forever otherwise. um, so thank you very much, and
It was a pleasure.
forward to catching up soon. Okay.
Okay.
Wow, I really hope you found my conversation with Jose as interesting and helpful and reassuring as I did. What really stays with me is just how his own lived experience, alongside his clinical expertise, brings such a thoughtful and compassionate approach to supporting families with allergies. So there's so much in this episode about building confidence, managing risk in a realistic way, and helping children and adults live with allergies rather than feeling limited by them. So if you'd like to find out more about Jose's work or access his clinic, you can visit the children'sallergy.co.uk or follow him on Instagram at children'sallergy. And as ever, thank you very much for listening, and see you for the next one.